Hi everyone, this is Neil Writer, consultant audiologist and director of Earwax. Thank you for joining me in my latest video using the wax scale. And here we're using our new size 2 teardrop speculus. This is our standard medium size if you like. This patient attended with fully occluding dense, dark, sticky wax, wet wax in both ears. This is the right side. I've just had to install some medical grade olive oil spray very early on just to help to coagulate this, just to bind it together. We're seeing a lot of this at the moment because of the increased temperatures in the UK. So earwax is made up of loads of fatty acids, lipids, cholesterols, and in the heat they can kind of melt and expand and become more gooey and sticky. So I've had majority of cases this week, even in patients who previously attended with quite dry wax, a bit firmer wax, they're attending with this consistency. It's a horrible consistency to remove because you will naturally get some staining of the ear canal, which is fine, even with the use of olive oil. You can see it's quite dark. The deeper we go, it's darker, so that wax has been there longer, it's oxidized. Now, with this type of wax, just going to be, you just don't want to submerge and apply too much pressure with the suction tip because it will just block the suction tip and you'll just indent against the surface. So just want to kiss the surface and use olive oil drops where it's not contraindicated. So obviously if this patient's got a ventilation tube, i.e. grommet or perforation, for example, or active infection, you want to avoid drops, obviously. But this patient's got no history of that. So that plug came away nicely. This is a bit deeper. It's just the colour change. It's just getting darker and darker as we're getting deeper in the ear. And I think their left side, it was even more kind of mushier, if you like. Now, fortunately, the oil really helped to coagulate this, so it came out a nice plug. And there is a bit of staining around the edge. I'm just going to mop some of that up, but the eardrum's nice and healthy. They can hear very well. So because we're working close to the canal, we've got to be careful. And because it is a soft consistency of wax, you just can't really remove all of it. In fact, you can smother it. And when you're working close to the canal, you're risking lacerating the ear canal. So you just want to hover over. If it comes away, brilliant. If not, it's not a problem. So with this consistency, it's just too wet and loose. You're just gonna, I would have got some wax out, of course, but it would spread a lot of it, like butter on a slice of toast. So we want to avoid that. So suction is definitely the best method to remove this type of wax. And of course, an ear hook will, well, it's just gonna dissect through it, and forceps, it's just the wax is just too wet. So it's gonna have a final look at the eardrum. Bit of a narrow entrance. It's going to get the eardrum focus. All looks good. And we're going to move on to the left side. So I've just put the oil in straight away, I think. So in both ears, the wax is extending from the entrance all the way to the eardrum. You can just see how wet and obviously we put some drops in, even prior to that. It was just really wet, loose. Ideally, the best consistency of wax is, for me, a bit firmer. Even harder wax where you can use a hook or correct, or in forceps, even suction, and kind of get it out in a big piece. It's quicker. And you don't have to use drops quite often with that as well. So here I'm going to use drops on several occasions. So to the right, we're just going to be careful, we're not going to graze the posterior canal wall. You can see the anterior canal wall, which is really useful. It gives us an idea of where exactly the ear canal is. So, of course, we don't want to make contact and bump into that. On the posterior side, we've got a fair idea, but we can't still see it. So I'm just allowing the suction to do the job there. So I'm hovering it on the surface of the wax and just letting it. Here, I am trying to lift it up a little bit because there's a bit of skin in front of you. You can see where the suction tip is now. And then hopefully just lift it up a little bit. I'm pretty sure I'm going to use a bit more drops. Now I can see some of the posterior canal wall there as well, which is useful information for me. It's like the superior wax, so the northern hemisphere is darker than the southern hemisphere here. Just block the tube. I'm pretty sure I'm going to use some drops. I'm surprised at this point, because the worry is if I continued with that and I'm trying to suction and it's not vacuuming, I'm just pushing this wax a bit deep and I'm smothering it against the eardrum, which we don't want. So It was very evident at that particular point, and I'm going to use some more drops. You can just see how brilliantly the drops work. Just brings it all out together. Just trying to wriggle it through the entrance. And I'm just going to do a bit of mopping up now. So yeah, it looks huge on the screen, but it's right near the entrance. You can see the edge in the distance already. And there's a bit of wax around the periphery, a bit of oil. So just going to mop that up. Just see how wet and loose it is. So we're on the cartilaginous portion here. So we can apply a bit of pressure. We can actually make contact with the canal wall. But again, you don't want to be gung-ho. And that's because cartilage, of course, is more rigid than the bony part of the ear canal, which is the inner 2/3. And also there's a thicker layer of skin lining the cartilage portion of the ear canal. It's about 1 millimeters in thickness, whereas the inner 2/3, the osseous, it's like 0.1 millimeters. It's a wafer thin layer of skin on bone, which makes the bony part very sensitive if you make contact with it. So we're just at the junction between the cartilage and bone here. It's just a bit of wet wax here, so we'll just, and because the hairs are there, the wax kind of coats against the hairs, so it's a bit more tricky to kind of vacuum and clean. But I'm pretty happy with that. We're gonna have a good final look at the patient's eardrum. I'm gonna get that in focus a bit there. Do I get that? I think I do. Just hover over it as much as I can. A bit sticky skin. And then we'll just get the eardrum in focus. You can see it's fully visible. Well, I hope you enjoyed that video, guys. Take care, keep well, speak soon. Bye.